the Region of Waterloo's YouTube channel after today's town hall meeting, primarily to allow other businesses who weren't able to attend this morning's town hall to have a chance to view it. I'd start off by just introducing myself. I'm Matthew Chandy. I manage the Region of Waterloo's Economic Development Office. I want to thank, we as a group want to thank all the businesses for participating this morning, for spending some of your time to participate in this town hall and share your thoughts with us. As businesses continue to start to reopen, we know there's, it's been a bit of a challenge trying to navigate guidelines and keep employees and customers safe. So we understand there's lots of questions. We hope that today's discussion with Dr. Shuli Wang, our Acting Medical Officer of Health, will help address some of those questions and allow for a dialogue with our business community. It'll also allow an opportunity for us to hear from you on what's worked well and what challenges you've experienced, and get some input as we move forward with various initiatives. So at this time, I'm going to turn it over to Laura Philippe and Dr. Shuli Wang to get the town hall going.
Hi, everyone. I just wanted to set a couple expectations about how the town hall will run today, and then I'll pass it over to Dr. Wang for her comments. So we're going to use a closed moderated approach here. So please feel free, if you have questions as we go along, to send those. They'll come to myself, and then I will relay those over to Dr. Wang. And we feel that'll be the easiest way to kind of keep the conversation focused today. Definitely all conversation and comments will be taken into consideration and passed on. So feel confident in that. And I will now pass it over to Dr. Wang.
Hi, everyone. I'm just going to first start by introducing a couple of members of the public health team. We have two managers with us today, Chris Komorowski and Aldo Franco. They are managers in our health protection and investigation a division, which has the public health inspectors within it. And so some of you have maybe had some connection with our public health inspectors. So I just I wanted to introduce them because they're here to help me answer some questions that may come up about more specific recommendations for businesses. So thank you. So I'll just, I had some remarks to start off. There's been a lot of discussion recently about the wearing of masks in business settings due to an order issued by the Medical Officer of Health in Wellington, Dufferin Guelph, to business owners, operators to enforce the wearing of masks among their patrons. This has led to people who have expressed opinions for and against a similar order here. As some of you may have heard, I have not been in support of an order from the Medical Officer of Health that puts the onus solely on businesses for enforcement without consulting with businesses first. I am in support of policies that promote the broad adoption of the recommended public health practices in business settings. As you may have heard, last night, Region of Waterloo Council voted to ask staff to bring back a draft mandatory mask bylaw to be considered at a special council meeting on either July 6th or 7th, the date is to be determined, for settings such as public transit and indoor settings. In addition, if a bylaw were not to be passed, there may come a time when I feel I would need to issue a medical officer of health order for the wearing of masks in such settings. So for these reasons, I wanted to consult with the business community on how best to strengthen the adoption of the recommended public health measures in business settings, including not only mask wearing, but also the very important measures of physical distancing and hand washing by staff and patrons. I know that all businesses have had to work hard and put in place a lot of measures that have been recommended or required by public health in order to open and operate safely. So I really wanted to thank all the businesses for that. So we would also like to hear from you regarding what has worked well and what challenges you have encountered in your efforts to enable these public health practices among your staff and patrons. So in conclusion, regardless if a bylaw is passed or an order is issued, I believe it's important to engage those who would have a role in implementing the measures and enabling the practices, and who will be helping us change the social norm. So thank you for doing what you're doing to help protect our community. So I'll ask Laura to bring up the next slide, which has the consultation questions, including one that we added since the motion at council passed late last night. So I'll just see if I can, Laura, are you able to bring it up on screen? I'll start by reading the first two. The first one was, how can we strengthen the adoption of recommended public health measures in business settings, including physical distancing, the wearing of face coverings or cloth masks, and hand washing by staff and patrons? The second one was, what has worked well and what challenges have you encountered in your efforts to enable these practices among staff and patrons? And I think there's a third one. Yes, the third one that we've added. What should staff and council consider when drafting a face mask bylaw? So that's kind of all I wanted to say as introductory remarks. I'll open it up now to comments, feedback, questions, and Laura will moderate them as she mentioned. Sorry, moderate this part, I meant.
Hi there, sorry, just lost my screen, and I see we do have a question here, so just give me 1 moment. Sorry, my chat screen has just disappeared on me for a moment here. Okay, so our first question is, as a fitness facility, it would be difficult to ask patrons to wear masks while doing cardio. Do you have any comments that you can share with us on that, Dr. Wong?
I wouldn't have any specific comments at this time, but I understand, obviously, it would be more challenging for people that are exercising to wear a mask. I'm, not suggesting that, I actually don't know what will be in the draft bylaw that's to come back, because that's just been a direction given by council to staff late last night, and so staff will have to work on that. But you know, what I have recommended is that businesses put in place you know, measures to enable physical distancing, and you know, if physical distancing cannot be maintained, then I would recommend that masks be worn. So, for example, for some businesses where you know, there isn't that physical distancing that can be maintained, and which, you know, public health inspects, masks are required in those circumstances, because the physical distancing cannot be maintained. Yeah, so the recommendation would apply in those circumstances.
Thank you. Okay, I have another one. As a retail grocery store, we are concerned about having staff enforce a mandatory mask order or bylaw. We do not want to be arguing with customers who come into the store unmasked, and that could cause more risk of infection if we have to spend time with each customer explaining the rules.
Yes, no, so thank you. Like, this is the, you know, the type of feedback that I was hoping to get. I know there's a range of views, but it's important to get the, you know, views from the business community. So thank you. Yeah, that's definitely one of the considerations.
Other thoughts and questions from the group here? Oh, I see we've got a couple more here actually. Okay, if masks become required, would it be the role of the store to provide masks to the public? And are there any concerns for those less fortunate that may not have access to facial coverings?
Yes, so all I can tell you is sort of what has happened, you know, in other areas of Ontario where there has been a mask order issued by the medical officer of health. So, for example, in Wellington, Dufferin, and Guelph, the order there does not order the business to supply masks. That said, some businesses have opted to provide disposable masks if a patron doesn't bring their own. So it's, you know, it's what's happened over there. But, you know, we're going to note that as a question. We don't really know what is going to be in the draft bylaw or what will be actually voted on or not as a bylaw by council, but I can just tell you what's happened elsewhere. Sorry, there was a second question, Laura, I think you said? There was two parts to it?
Well, just if there's any concerns about maybe those that are less fortunate may not have access to facial coverings.
Yeah, so, you know, that's definitely one of the considerations, right? Whenever you make something mandatory, you have to think about potential economic or access issues for and you know, that may apply to certain people, and ways that you can help mitigate that. So it's definitely one of the considerations when you think about a mandatory policy. Yeah.
Thank you. And just in follow-up to the retail grocery store question before, in terms of having to spend time with customers who come into the store unmasked, the same person has said that they've had lots of success enforcing a capacity requirement of a maximum of 3 customers in the store, and that this has made it a lot easier to do safe distancing.
Thank you. No, that's good to hear. Yeah, and yeah, the first concern that business owner raised is exactly why I didn't want to mandate, put it in order that would mandate businesses without first speaking with them, because this is the concern that you know, that I had, that it could be very challenging just to put the onus on the business owner to enforce a public behavior.
Perfect. Thank you. Sorry, just a comment from one of our participants who joined us a little late. They missed the beginning of the meeting and are asking if legislation has been passed already or if it's being sent for review. Just as a very quick summary, last night at council, the council recommended that a bylaw be put into, that staff develop a bylaw for review at a special council meeting that will either happen on July 6th or 7th, recommending face masks be mandatory on transit and indoor settings. So that's hot off the presses there for those that missed the beginning of the meeting. Maybe we can shift a little bit to offices now. They're wondering if you have any recommendations for those working in office settings, and if there's anything beyond physical distancing that businesses can do to make their employees feel more comfortable in an office setting.
Yeah, so there's general recommendations that have been put forth by the province. They've released over 150 guidelines for various work settings. And so, we'd be happy to just make clear where people can find that guidance. But in general, the measures that we would recommend are really based on those principles of physical distancing as much as possible, right? And like one of the persons mentioned, when the business owner mentioned, there's measures that you can put in place that make that easier for people to practice that physical distancing. Making it really easy for employees to be able to wash their hands. Just sort of reinforcing the need for employees not to come to work or be around others, actually, whenever they start to develop symptoms. And, if they have symptoms that could be due to COVID, then recommend that they get tested. And if you're in a setting where you can't really maintain that physical distancing, and there needs to be that close contact between people, then I would recommend that employees wear face coverings or cloth masks whenever they are physically close to others. Of course, once they distance, once they go and take a break, they can remove those masks. But if they're having to work closely with people, they should wear those masks while they are in close contact with others.
Thank you. I've got a good question here about hearing impaired residents in Waterloo region. This person has a team member who's hearing impaired, and they're wondering if masks do become mandatory, does it have to be masks, or could shields be used as an option? Because face shields make reading lips possible, and as they don't tie behind the ears, it wouldn't pull on a hearing aid. So just wondering about that differentiation in that circumstance.
Yeah, so generally what's been recommended are masks, because they serve as a form of catching the droplets that somebody can release from their nose or mouth, right? So the face shield is sort of something that can potentially protect droplets from other people from coming onto you. But the reason that it's a face covering or a face mask that's recommended is because it would serve as a way to prevent that person's droplets from their nose or mouth to be released, into the air in close proximity to someone else. It's sort of akin to the notion of covering your cough with your elbow or a tissue, right? It's to block the transmission of droplets. So I don't think that, I recognize what the person is saying, though. It could be a barrier for people that are, don't hear well and rely on the looking at lips, that they would find it more difficult if others were in a mask. But it wouldn't really be face shields that we would be would be uh, that would be what would be recommended in such a bylaw or order. It would really be masks.
And we do have someone that has spoken up, and they said they have hearing aids, and it is difficult to wear a mask, but it is doable. Obviously, that doesn't address the lip reading issue as you were just discussing, but just a comment.
Mm-hmm.
Maybe now we'll move to fashion retail. So we have someone here who runs a fashion retail store, and there's been new changes to their procedures, including sanitizing change rooms.
Mm-hmm.
This person has required their clients to wear masks in store. They can buy locally made ones right in the store,
Mm-hmm.
but they understand that not all stores are making their patrons wear masks, and the inconsistency is challenging. And trying to keep clients wearing masks while trying on clothes is difficult to enforce.
Mm-hmm.
The clothing is quarantined after it's been tried on, but there's not really any clear guidelines on what is actually expected in those situations.
Mm-hmm.
Just
so I don't know if Aldo or Chris might have some additional information. We'd have to check if there's a specific if the guidance that's been released by the province in regards to retail settings might be able to answer that, or if it's something that we can forward up to the province, for example, as a question that our retailers are asking, and we're hoping for provincial guidance on.
I'll just say that we don't normally or regularly inspect those types of shops, so we wouldn't have specific guidance on that. However, we have heard of those types of stores do quarantine their clothes for up to a couple days to just help, because it's been noted. It's just like it seems to be a best practice to try to ensure that there's reduced risk of transmissibility amongst people trying clothes on. But other than that, as Shuli said, it would be up to, we'd probably have to refer to the province and their 150 or so guidance documents on their website around that kind of, that specific industry.
Yeah, so as Aldo mentioned, so public health, generally they have a legislative mandate to inspect certain workplaces, but it's only a small subset of the many workplaces, in our region, and generally we don't inspect retail settings like clothes stores. So, but the province has produced a lot of guidance, and maybe one of the things we could do, Aldo, is take a look if there's any specific guidance for those types of businesses, and whether if it's a question that we've been asked, we could send that question back up to the ministry and see if they can provide some guidance around that. What do you think, Aldo?
Yeah, we'll have to see what's available already.
Okay, yeah.
Great, thank you for that question. All right, the next one is from one of our local restaurants owner. He says that they've had staff, especially in hot places like kitchens, that complain that the masks make them dizzy due to the heat and the airflow. So they've been allowing visors in that situation to be used instead. Is there an option that solves that specific issue?
That's definitely a challenge when it's very heated. I would say, the foundation really is physical distancing, right? Masks are recommended when that can't be something that's done. So I guess a question I may have is there a way to enable the physical distancing so that the staff don't have to wear the masks, for example, when they're in that hot environment? But recognizing that for those that do have to wear masks in hot environments, it is a challenge, and we have dealt with some businesses where they have to wear the masks, and it's not necessarily cool in their workplace, so it does get hot.
Okay, and there's just a quick follow-up to that question.
Sure, sure.
I will let him type that in there.
Okay, okay, I'll open up the chat.
Okay, so actually, while we're waiting for the follow-up on that one, maybe we can just quickly, the next question is, if physical distancing is not possible and masks are being worn, how important is eye protection in minimizing the risk of transmission?
Yeah, no, eye protection is something you will see in healthcare settings. It's not generally something that's, recommended for the general public in the general public setting. But people can choose to also, if they want to wear additional eye protection, it's anytime you do have what we call in medicine mucous membrane, so to speak. You could have potentially some transmission, but in general, for the general public in workplace settings that are not specific to healthcare, then what would be recommended if physical distancing cannot be maintained is a non-cloth mask or face covering.
And I have that follow-up question now.
Sure.
Okay, so he would just like to state that for the record, he's pro-masks and they really are encouraging their employees to tough it out. But when and if the rules change and masks are made mandatory, will physical distancing in a kitchen allow us to not wear a mask? Or would that recommendation that you just provided overrule that?
My recommendation that I just provided, it's that's one of the challenges when you actually put in place a bylaw. You have to make sure it's very specific, and it's it outlines what is or isn't required. So it may not necessarily be exactly as the recommendations, because the recommendations are the general principles that you want to follow. So, we'll have to see what the proposed bylaw actually says. But in terms of the recommendation and the principles that I would that I would suggest, it's really if employees, if a workplace can maintain the physical distancing through engineering controls, for example, or the way that they space employees and how they work, then I wouldn't recommend that masks also be used. It would only be for situations where they couldn't maintain that physical distancing. They had to continue to be in close contact with each other in order to carry out their work. For those circumstances, I would recommend the wearing of a face covering or cloth mask.
Thank you. We have a local yoga studio who is looking for information on phase 3 reopenings.
Right.
Trying to get some idea around detailed guidelines for the business and what patrons can expect when they return. Just wondering if anyone here, I'm not aware, and certainly can dig around after, but do we know if those guidelines are available from the province yet, or are we still waiting on some of those?
We're still waiting on some of those. I mean, totally understand. That's the question people are turning their minds to now, right? Because now that we're in phase 2. So yeah, so as soon as we have that information, which can often be when the province releases it to the general public, we will work to make that available on our website and through the email channels for the business community, circulate that. Although we wouldn't circulate it every time a new guidance came out, but of course some some significant information about phase 3, we would try to circulate that out as well.
Yeah, we'll definitely make sure to share those as it comes out.
Mm-hmm.
This is a great one. If you're wearing a face shield, is a mask still required?
Yes, because the mask would act as what they call source control. So it is a means to, like covering your cough, it is a means to prevent the person's droplets from leaving their nose and mouth and possibly being breathed in by somebody else close to them. So the shield is just something that protects things coming at the person, but it doesn't prevent the droplets from leaving that person's nose or mouth.
Thank you. Our next question is, as more businesses open, for example, the inside of restaurants, will the region be providing any visuals or protocols on recommended practices? Materials provided by the province to date are moderately helpful, but lack applicability. For example, they provide broad suggestions rather than practical tips.
Yeah. So I don't know, Aldo or Chris, if you want to try and take that one, because it's restaurants.
That's been a bit of our challenge is, we're trying to operate with what the province has provided us and making it as helpful as possible. And I can only direct you to our website under our workplaces page, where we have guidelines for, right now it's patios. If and when indoor dining is permitted, I can't see it changing too much from that. It all depends on what stage 3 and what comes down the road, but those are the principles, as Julie was saying, are about physical distancing and wearing a mask when it's not possible. I think those are the key things that are going to continue to prevail as the norm going forward.
We're also in ongoing conversations with the business community, and I provided different types of signs from the ministry. We have our own here in public health, and if there's something that we can create locally, we're all ears, basically, and we're here to support the community.
Thank you. I'll follow up with an email with the person who asked the question, and if they have any specific ideas for signs they'd like to see, those kinds of things can be sent directly to myself or to public health, and we will absolutely, look at taking that feedback back and seeing what we can do. Okay, next question. Would it be the role of our public health inspector to assess the workplace to verify that we have implemented sufficient distancing measures? Is there someone who can say, so basically, is there someone who can say whether masks are necessary or not in the workplace?
Yeah, so there's, I'll actually hand it over to Aldo or Chris to answer, but I'll just introduce that, just with the sheer number of businesses, outside of the ones we have a mandate to inspect and oversee, in terms of their adherence to requirements, we wouldn't be able to respond to all businesses who would like us to just review their plans and make sure that everything is the way it should be. We totally understand why businesses would want us to do that, but we just wouldn't be able to do that with the sheer number of businesses, and we're not actually familiar with most businesses outside of the ones we normally inspect. But again, we would really refer you to the government's website, which they've produced a lot of guidance. I think it's over 150 guidance documents for specific settings as well, and we would advise just to follow the guidelines that are in there. But in terms of physical distancing, it's 6 feet. That's what we consider good physical distancing, maintaining 6 feet in between people. So Aldo, I don't know if you had anything you wanted to add to that. I may have actually done more than just introduced it, but
yeah, nothing much else to add. Our inspectors would obviously be able to support and help out during our regular inspections of places that we inspect.
Thank you. Our next question is around masks in office settings. So if masks do become mandatory, would they be mandatory at all times in an office setting? For instance, if physical distancing is enabled or there's no clients in the building, would masks still be required in those settings?
Yeah, so it's a very understandable question. So I wouldn't know what would be in the proposed bylaw, because I don't know what's going to be drafted, and I'm not sure what council will ultimately vote on. But in terms of the recommendations and the principles that I have been recommending and would continue to recommend for any policy that the government wants, regional government wants to put in through a bylaw, it would be in indoor office settings. The ideal would be to enable the setting. Would be to set up the setting such that it would enable the employees to be able to work physically distant from each other. And if they're not able to do that, that would be the circumstance in which I would recommend the use of masks. So if they're able to physically distance, no, they don't need to wear masks.
Thank you. So that's the last question I have in the chat for now. So obviously, if there are other questions, please feel free to send those through. But maybe now would be a good time to take a look at the questions, Julie, that you had
Sure.
asked, and maybe we could look to receive some feedback on those from the businesses on the call, if that would be a good time.
Sure. So, if people have any experiences to share in terms of, like, we had one earlier where someone said, I've done this and this has worked well. If you've put in place a policy, if you try to enact or enable these practices, I mean, I know you all have, in terms of the basic requirements and the recommendations that have been provided, but more in terms of how has your experience been with trying to enable these practices among patrons and staff. If you have anything to share, I'd be happy to hear that. Or if you have any, things that you think staff and council need to consider, besides several that have already been mentioned, when they draft and consider a bylaw, please let us know as well.
And we actually do have a quick follow-up to the conversation about masks in the office place.
Yes.
And the concern is, well, what if we work in an office and someone is sick there and they don't have a mask on, and now the virus is spread to where they've been in shared areas like printers and that type of.
So that that raises the other important factor, that as part of a comprehensive package of recommendations or policies that a workplace would enforce, one of the key ones would be with regards to their own employees, right? And having policies in place so that people don't work when they're sick as much as possible. Now, that said, even with the best policies, sometimes it happens, right? Someone has been sick, has been symptomatic while they worked, and then later, they'll tell the employer, yeah, I have COVID, or I've been diagnosed with COVID. In that case, public health does get the results of people who have been tested and who have tested positive. We don't get the negative results, but we get the positive results. And so if there's somebody who has had COVID, without revealing personal health information, which we can't reveal, we would be in contact with the business if there was in the assessment of that case, the identification of a potential exposure risk, to others in the workplace that we believe would need to be followed up on. And so that would occur. We would connect with the businesses in those circumstances. And, there have been a number of times that we've done that already, simply because we know with the broad testing that's now available for basically anyone in our community, who would like to have a test. We are going to pick up cases, and likely more cases, just because there's more testing of workers that have COVID. So it's going to be something that's probably going to be part of the normal that we are all going to have experience with. And the key thing really is, when we pick it up, we make sure the person understands in terms of the public health measures that they have to put in place themselves, such as self-isolate from others for 14 days. And as mentioned, if there's a potential for an increased risk to the workplace setting or other employees, public health would be in contact with that business setting.
Thank you. Our next one comes from an essential services food plant. So they have implemented a significant number of COVID safety precautions, and as they begin to develop a progressive plan to return to the new normal by adjusting these precautions, would this be an internal company decision, or should they be consulting with public health on the plan?
Yeah, so it depends if we normally inspect them or not. There, I suspect in those ones we don't, just by their description, food processing plant. So if I'm not mistaken, Aldo or Chris, I think that's maybe OMAFRA. Is it OMAFRA or CFIA and the Ministry of Labor that are also involved?
Depends on the type of plant. Yeah, it could be
Okay.
CFIA, it could be OMAFRA, and for sure Ministry of Labor.
Yes. So those would be the usual ministries that have jurisdictional oversight. Would be the ones that workplace would would consult first in terms of their plans, because those ministries are more familiar with those specific types of workplaces. But anytime there is a potential outbreak in a business, that's when public health would also be involved. They would also come into the picture and work alongside, the Ministry of Labor, OMAFRA, CFIA, and of course the plant owner operator, to help them ensure that the appropriate infection prevention and control measures were put in place in the plant.
Thank you. The next question is, even when physical distancing between customers and staff is possible, what role could masks play in protecting the products from the virus? Specifically, this person's product is books.
Right. So there isn't really any evidence that there's a need to do additional things besides the wearing of masks when people could be in close contact with each other. In terms of the objects, there isn't any additional recommendations generally for objects in the business environment. That said, there are recommendations about just making sure that you regularly clean and disinfect commonly touched surfaces, using the common disinfectants and cleaners that you would have for that. And again, usually they're laid out, if not in a sector-specific guidance document from the ministry, then they're laid out in the guidance document for workplaces in general. So again, I would we you know what, we're going to send out that link to this group for that page on the ministry's website. That is the link, the portal, so to speak, to those 150 guidance documents for various workplaces. You should be able to find something in there that is most suited to your particular workplace setting.
Great, thank you. I now have a couple comments for you in terms of feedback on the questions that you've posed. The first is that physical barriers and floor markings have been effective in our retail workplace, and they were provided with floor stickers from the Downtown Kitchener BIA.
Right.
But they find that customers don't really read the signs if there's a lot of policies and things to read.
Right. Right. So they're maybe saying make things simple, make things clear. Okay,
That
good.
seems like a reasonable, way to summarize.
Thank you. Thank you. No, thank you for letting us know. Yeah, I was hopeful that, those, arrows on the floor and those barriers would help. Those are really good examples of things that help clients and staff kind of follow or adhere to physical distancing. So I'm glad to hear that your experiences that they help.
Another comment, the main challenge that this person has had when implementing
Yes.
masks in their company has been workers with pre-existing medical conditions like asthma and their complaints and inability to wear masks. What should they do?
Yeah. So, there are definitely those among us who can't wear masks for either health reasons or because they just simply feel they can't breathe with a mask on. So, my recommendation would be that we take people at their word, unless there's a policy in a workplace that requires more information about that, which is up to the employer. But in terms of the general public, it would be. I don't think it would be possible to ask, for example, business owners to arbitrate when somebody should or shouldn't be, or somebody can or can't be wearing a mask. So, I think really the simplest solution is that we ask people to, be honest and just if they can wear a mask, wear a mask. But if they can't, to be taken at their word that they're unable to. And of course, there are certain people as well for whom a mask isn't recommended. So, for example, children under the age of 2, or someone for which they wouldn't have, it wouldn't be easy for them to actually put on their mask and then take off their mask. So they would have some difficulty in actually putting on and taking off. Obviously, we wouldn't want them to try to be fiddling with a mask because that could actually potentially increase the risk if they're not putting on their mask properly and fiddling with it too much and things like that. So so there's going to be, but if the vast majority of us who can wear a mask, then it will help to protect those among us who can't.
A quick follow-up about the comment about signage being overwhelming, and we do have another business owner here who agrees that they feel the signage is overwhelming for their customers.
Right. So I was wondering if that person could give an example of what he means by overwhelming. Is it like too much instruction? Is there anything that he or she would suggest in terms of how to make it simpler, how to make it, like less overwhelming?
While we wait for a response on that one, I will give you another question. It's a follow-up regarding the hearing impairment and ability to read lips. So
Yes.
if masks become mandatory at all times and that impacts the employee's ability to do their job, as they will not be able to communicate with customers or fellow employees, how are we going to mitigate those circumstances? Because in that case, it seems to them that it would go against the Accessibility for Ontario's with Disabilities Act, and I'm just wondering about exceptions.
Yeah, no, that's excellent. So I don't have a specific answer about how that would be mitigated, but that would be an important item that a bylaw would need to try to mitigate. So thank you for that. That's something I think we just need to take back.
Thank you. And the comment in terms of your feedback on the signage, getting a couple examples here. So they have signage to call, for example, if the door is locked, They have a collaborative space. It's a fashion retail shop and wellness massage clinic in downtown Kitchener.
Right.
So they have separated entrances. The wellness clinic gets people to call to be let in, and then the retail store has a side entrance for people to enter.
Okay.
But customers seem to get confused about which door to go into and who to call, and it seems like there's a lot of confusion there.
Okay. I think it sounds like that may be more like the operational implementation of the recommendations. And yeah, that might not be something that we would be able to provide more guidance on it, because it sounds pretty specific in terms of the actual, it sounds maybe specific to the actual setting. But for sure, I think it would be important for those crafting a draft bylaw to keep in mind that we need to try to keep the instructions in the bylaw as simple as possible, not so as to not add additional, potential confusion onto a business setting like that.
Yeah, thank you for addressing that. And they say they're definitely working on trying to simplify the signage, and I appreciate you addressing it.
Thank you for just sending in the feedback. It's good to know what the experiences are. These are the real world realities that you are dealing with.
Okay. So are there sanitization concerns around cloth masks gathering excess bacteria? And what are public health's recommendations when it comes to replacing masks and washing them? Will the responsibility be on the business owner to supply and clean the staff's facial coverings?
No, generally when these kinds of orders have been put in place, the expectation is that people bring their own masks. But the question raises, it's a very good question, because that's something we're going to try to make sure is available in terms of information for the general public and businesses, which is, how do you wash your masks? When should you change your mask? Things like that. So we do have that info, or at least some of that information, on our website. But it's something that our communications people can just take back and see, just make sure we have it prominently. And maybe there are other vehicles through which we also need to make it more easily accessible, in addition to our website, like maybe send out some information to the business community, highlight that if that's a common question and concern. But there are definitely recommendations with respect to that. It's kind of a list, and so I won't go through them here. But the other thing is, as part of the proceedings, so to speak, of this session, along with the video link, we could send out, like I mentioned, that web address for the portal for the guidance documents, but also a link to the area on our website that contains information for how to care for your mask, when to change your mask, things like that.
And just a question about exactly where those recommendations are found. So those wouldn't, this person's asking specifically if they're on the Woolwich website. They're all listed on the Region of Waterloo's public health website in the COVID-19 section there. I can't personally comment on whether it's on the municipal websites, but definitely on the region site.
Yeah, we don't know if it's on the area municipal websites, but it would be on the region's website. And again, in case it's not easy to find, maybe what we can do is just send a link to the web page, the landing page on our region's website. That is the landing page for information for businesses. Is that what it's called, Aldo? We have that page, right? Information for businesses.
Workplaces. It's called
workplaces. Yeah. Thanks. Yeah. So we'll send out that direct link as well.
And just a comment from actually our local airport. Apparently the signage has been challenging at the airport as well. And they're currently consolidating signage to try and clean up some of the visual clutter there. So definitely the signage seems to be a theme across businesses.
Yeah, I was just wondering, one of the things I was wondering is, if there was a common template for a sign that the region could produce, like wear a mask sign that maybe businesses could put in their windows or something. Would that be something that you would like to have the option to have?
Just waiting to see what responses we get here.
And we can have other ones, like physical distancing and.
We're getting yes, please. Yes.
Yes.
Yeah.
Okay. All right. Okay. Okay. That's good, because that's something we can work on.
Yes, wear a mask sign in the same design as the region hand washing sign.
Good. Okay.
Some other yeses.
Okay. Consistent.
Yeah, then it's
Visual.
going to look more consistent and all businesses are on the same page.
Got it. Okay. That's very good. Thank you.
Okay, and we have about 3 minutes left to be respectful of time. So if there are any, we might be able to have time to take one more question if there are any coming through. Give it a minute here. Well, maybe now would be a good opportunity just to say thank you to everyone on the call for coming here. Obviously, Dr. Wong, thank you very, very much for your time. And we will follow up on this. There are definitely a few links that we need to send out and some questions about that. If you do have other questions, though, I would like to offer out in the meantime. Feel free to reach out to economic development here at the Region of Waterloo. We would happily take that feedback in and work with public health on making sure that your questions as businesses in the region are being addressed and that your feedback is going into this bylaw. And we will be, so we'll be in touch with those. We're also going to send out a short survey so that if you do come up with other ideas or questions, you can send that out, or if you have colleagues that weren't able to attend and would like to provide their feedback, that they have a forum to do so. And again, the recording will be up on the region's YouTube site later today.
Laura, I want to thank you for moderating the session, and for all those that are behind the scenes to get it going. And I really want to, on behalf of our team here at Public Health, we really appreciate you taking the time, to give us your feedback, to let us know of some of the questions that you are wondering about. We appreciate this opportunity to be able to connect with you. Thank you. And thank you for all that you're doing. We know you're working really hard, to make it safe for your patrons and for your staff. And we really appreciate that.
Matthew, did you have any final remarks before we end the call?
No, just again, thank you to all the businesses, and we hope this is, we've received a lot of questions over the last couple weeks in particular, so we hope this is helping to address some of those questions, and we know there'll be more, so we'll look forward to supporting businesses through those questions and getting you the best answers we can. So thank you very much to everyone.
Thank you.
Thanks, everyone. Enjoy the rest of your day, and thank you again for joining us.
Thank you.